Okay, so I got a letter. I've actually gotten a few letters. I don't know that I would definitely make this a regular practice or not, but this is a Dear Dr. Jones letter. Hi, Dr. Jones. I wanted to let you know that your videos have personally helped a lot in dealing with trauma and actually understanding others. Thank you for creating your page. I wanted to ask you if you can make a video talking about people who were molested at a young age and are now adults who are hypersexual, participate in shocking and deviant sexual behaviors, and who seek male validation. In their minds, they find that these behaviors are normal. I am trying to understand this and not be judgmental towards some friends and families. I guess I am trying to figure out if this is something that someone can outgrow in their lifetime. Hi, I'm Dr. Natalie Jones. So thank you for writing this. And it's a very interesting letter. Okay, so I'll start with the first thing that comes off of my mind, and just a reminder, these are general tips and suggestions, but of course, if you need more in-depth help, it's always a good idea to see your own personal clinician, your own personal licensed therapist or psychiatrist. So the first thing that stands out in my mind is number one, like the people who you surround yourself are typically a mirror, meaning that they are reflecting back to you some traits about yourself. So we typically, I think our friend Masterpiece says, show me your friends and I'll tell you your future. So there's something in you that is attracted to or connected to people like that. So a lot of times our friends and our partners and things like that mirror some aspects of our life. Or some traits that we have, or some aspects of our lives, one of our many life lessons that we need to learn and work through, and so they will reflect that back to us. The second thing is sometimes you do have to be judgmental in terms of who you surround yourself with. In fact, I recommend that you do. And not judgmental in a bad way, but more of making a personal assessment, a relationship assessment, a character assessment. Are these people really reflective of me, right? Because you are the company that you keep, as I was saying earlier. So you have to look at is this something that I really want to be surrounded by? Or are these people that I've outgrown? Or are these people unhealthy for me? Do I really need to be in a relationship with these people? And including if that person is family. So I would invite you or encourage you to do a relationship evaluation or assessment on your own, and you should probably be doing this once every 3 months, and not just you, but everybody, myself included, to make sure that your people that you have in your life are truly reflective of the values, the standards and everything that you represent. It's not your job to understand people. You can be kind towards people, but it's not your job to understand all of the things that they're struggling with. I actually encourage people not to do that, because otherwise, you have a job in being a therapist or something like that, right? So I would encourage you to be more selective and judge who, just more selective about who you allow in your life and in your space and in your energy and who has access to you. And so if some people will find, people are allowed to say that their own behaviors are normal, right? That's their version of reality. That's why you have to make the more accurate assessment of is this who I need to be surrounding myself with, or is this truly reflective? I can't really get with that. So an example would be I don't know, people who do drugs. I don't do drugs. I'm clean, I'm sober, I've never been a drug user, so it wouldn't make sense for me to be surrounded by people that are always using and abusing drugs. It doesn't flow with who I am and my character. Hope that makes. What I'll say about people that have been molested at a young age and are now adults, I think, molestation affects people very differently. They could be anywhere on the spectrum in terms of sex and sexuality. Some people can be asexual, some people can be hypersexual, some people can be sexual but dissociate during sex. They can have all sorts of intimacy challenges and disorders when they've been molested, and it's also not uncommon for people to have sexual deviance. So for example, a lot of child molesters that I've worked with over the years have also reported that they were molested as children. Not all, but a lot of them have been. So I actually think a lot of BDSM and kink culture is really born, and I know a lot of people are going to disagree with me on this, but I actually think a lot of that kind of stuff comes from trauma. Not always, not all the time, but there are some exceptions, but I think by and large, a lot of people are reenacting their trauma, as well as people who are oppressed. A lot of women who've been oppressed and controlled their whole lives have rape-based dreams. It doesn't mean that they actually want to experience that, but it's more of a figment. It's more of an extension of being controlled even in their sex life. And so there are elements of, we can reenact our trauma, and we can continue sort of acting that out and living in that cycle, until we develop a level of self-awareness, until we see it as a problem. So there are people that can go for many years or even their entire lives sometimes. There can also be a lot of shame and a lot of guilt around those behaviors that people are having. And so, yeah, so is it normal? Yes, it is normal. So it does happen quite a bit with people who are abused. Is it healthy is what I think you're trying to ask. Is it healthy, and is it socially appropriate for that to be their entire personality? That's no. So the answer to that would be no. It's not necessarily healthy and appropriate for that. And so that's why I say you have to make that judgment call about whether or not that's appropriate for you to allow that in your life. And lastly, you asked if people can outgrow this in their lifetime. I think anything is possible. People can change at any time, but people, first of all, they have to see it as having a problem, and two, they have to have, again, that level of self-awareness, and then three, they have to be intentional and about creating change. And so, your friends and family may not have that level of social awareness, so they don't know necessarily how they show up in day-to-day life. I don't know if you've tried telling them that, telling them that, hey, that's inappropriate, or actually, what you're saying and doing right now is making me very uncomfortable. So maybe you might try, if you feel comfortable enough, to sort of lead with that. Because I've actually said that to people, like, that's not appropriate, or I'm not okay with that, I think we need to part ways here. Something to that effect is, that would be something that I would say. So anything's possible. Will they? Can't? Is it something that they're focused on right now? Maybe a better question. And if it's not, chances are, maybe this is where you guys need to part ways. Hope this helps.